to you about conservative management of a cruciate ligament injury and things to consider to help you make your decision and know that you're going in the right direction for yourself and for your dog. So understanding that conservative management means that you're not doing surgery, so you're not repairing or changing the angle of the joint. You're waiting for this scar tissue to build in the joint so that you don't get this movement. Some things to consider. Number one, if you're going to do conservative management, you really have to make sure that your dog is the appropriate weight for your dog's size. Number two, you want to make sure that your dog is on some sort of anti-inflammatories as well as possibly gabapentin. The reason you want anti-inflammatories is because there's some movement in this joint. It's causing inflammation, which is slowing down the healing and causing the pain. So by giving anti-inflammatories and gabapentin, we're addressing that pain so your dog can heal better. The third thing to consider, and this one's a hard one, if your dog is non-weight bearing, so i.e. after a week, 2 weeks, a month, your dog still will not put that leg down, you really have to consider something. Possibly, and I see this more often than not, dogs that really don't want to use the leg have probably torn the meniscus, which is the little C-shaped cups inside this joint. I can tell you, because I did it to myself, they're very painful because what happens is you get a little tear in there, and every time they go to bend, they hit that little flap, and it's very painful. And no amount of rehab, no amount of rest, no brace, no nothing is going to make that meniscus not hurt. The fourth thing to consider is shorter walks. So you want to have your dog on a 6-foot leash, walking with you, not off leash, no chasing balls, no playing frisbee, no running and playing with your other dog. And this restriction is going to be for a very long period of time because that scar tissue can take from 8 months to a year to build up. If you have a high energy, active dog, conservative management without a brace may not work for you. One of the other things to consider is doing some rehab exercise.